Welcome to the Thinking in Between podcast, where we meet people and explore ideas at the borderlands between health and social science. In each episode, we hear from a researcher working in this space about 3 ideas that have shaped their thinking and research. My name is Stephen Hibbs, and I'm a hospital doctor by background, but currently undertaking an ethnographic PhD at Queen Mary University of London. Today, I'm glad to be joined by Iona Hindes, a PhD student based at the Centre for Public Health and Policy at Queen Mary University of London. So, Iona, thanks so much for coming today, and could you start by telling us a bit about your background and what you've been working on during your PhD?
Yeah, of course. Thank you so much for having me, first of all. Very excited to be here. So I am studying through mixed methods the impact of COVID-19 lockdowns on birth and pregnancy outcomes and experiences. And I guess some context to how I got to studying that in a PhD was that I was very interested in a lot of different disciplines in school, and that led me to kind of have to weigh up my choices between biology and law and stuff, and that got me very interested in anthropology, because kind of got to explore all the social sciences aspect, but also could look specifically at medical anthropology, which obviously biology has an interesting component in. And so I did anthropology at Durham, which was great, and they had a very broad course, and it allowed me to explore the different facets of it, but I got very interested in medical anthropology. And then I finished university and the COVID-19 pandemic happened, and I'd always had this interest in public health, global health, and epidemiology and that side of things. And it just seemed like a really good opportunity to get qualified in that. So I did a master's in population health at UCL, which is great and kind of gave me some more tangible sort of understandings of viruses and how they spread, epidemiology, but also quantitative research methods to understand them. But I still always really enjoyed my kind of social science background and the tools that I'd gotten there with ethnography and anthropological insights and stuff. And that brought me to my PhD. So I developed a proposal and I got funded by the National Institute of Health Research, School of Primary Care. And I've gotten to study this kind of strange phenomenon and its impact on maternity through this mixed methods lens.
Brilliant. And we're going to hear more about your research as we go through your 3 ideas. I should say congratulations, because I know you handed in your thesis like 2 weeks ago or something like that.
Yeah, exactly. So fingers crossed, Viva's coming up.
Awesome. So we're gonna move to your first idea now, and the first idea you've brought is a book with a fascinating title: "Seriously, Investigating Crashes and Crises as if Women Mattered" by Cynthia Enloe. So could you tell us a bit about what the book's about, what it says, and then tell us why you chose it?
Yeah, absolutely. So Cynthia Enloe is this brilliant, I guess you'd call her a critical feminist theorist or researcher. I also am not necessarily an expert in her theoretical insights, but this piece of work really resonated with me in my research, so this is just my interpretation of it and how it was really useful to me. But I was introduced to this piece of work by a really useful training which was hosted by ListDTP at King's University and by an individual called Gabriella Stringer, who's also a PhD student at Queen Mary. And basically, Cynthia explores in her book, and she really brings home this need for what she calls a critical feminist analysis. And she discusses it in relation to a variety of different sort of the financial crash in the early 2000s, but different crises and phenomena throughout kind of modern history. And what she really brings home is this idea of the importance of everyday, and another point, which is the personal as political. So she was really exploring how, she describes it here as the dynamics of everyday to see the patriarchal structures of power at play and where it might be least apparent. So she's really thinking of looking at the gendered experiences of different phenomena and the unique impacts that they might have on women in particular. And so she really focuses on this idea of the importance of everyday as in, home life, different sectors of life, but really exploring where those big policy decisions have an impact, in the home and not necessarily in wider, more public economic spaces as we might think about it.
Could I ask, just to sort of ground us with an example from the start? Is there a kind of particular example of the everyday that she gives that I don't know, might be something that we take for granted, but that points to the point she's trying to make.
Yeah, absolutely. So one of the key examples which she takes is in relation to 2008, the 2008 recession and the financial crisis and the policy responses that came out of those. So, for example, austerity policies. And what she looks at in particular is how these policies had an unequal impact on women and specifically single mothers. And really, she describes it as exploring and asking where women are in each corner of each recession and why, and then continuing to ask those questions month after month to see where the economy takes twists and turns to affect people in different ways. So I think that really resonated with me because, lockdown was another very clear policy decision which had very unequal and very disproportionate impacts on different people because of their different circumstances. So I think that was a very interesting lens, which, I hope that's a specific enough example.
Yeah, thank you. And then so applying that to your research and thinking, what did that allow you to see as you were looking at COVID experiences of maternal experiences? Yeah,
so I think what I found very useful with reading Cynthia's work in particular was she describes this concept of developing a feminist curiosity. And she's written about this in a separate piece of work, which is called The Curious Feminist, Searching for Women in the New Age of Empire in London, England. But she touches on it as well in Seriously and kind of operationalizes it in Seriously and shows how she's done it in her work, which is just fascinating. But she describes this feminist curiosity as listening carefully, digging deep, and developing a long attention span, and being ready to be surprised. And I guess in my research, that was something that I took very personal as what I wanted to do as a researcher, but it was extremely useful for the field that I was working in particular. So I think in general it was useful to look at lockdown and the unequal impacts it had through this critical feminist lens, because it showed that, the majority of the people who had made the decisions about lockdown were male politicians. And they hadn't necessarily thought about all the repercussions that this would have for mothers and birthing individuals in particular. So this was really interesting as a theoretical lens because it meant that I could explore the gendered aspects of those policies and the gendered impacts it had, particularly in the field of maternal health, where, they might not have considered the number of birth partners that an individual might want and how that might not necessarily always be a partner. So very interesting in terms of a way to explore the unique and specific impacts in that sense. But I mentioned, I'll come back to feminist curiosity, which was interesting, and it was something that I found really interesting looking back at afterwards. So with this feminist curiosity, I was nervous at the start of my interviewing journey. So that was one of my methods in my thesis, was interviewing women who had been pregnant or given birth during the lockdowns, specifically in England. And something I was nervous about with my positionality was that I'm 26. I have never had a baby. Hopefully I will in the future, but it's not on my immediate timeline right now. None of my friends have babies yet, none of my siblings do, so it's a field which I'm very, I have a lot of lack of lived experience in that side. And it's also important to note that I'm not a clinician in any way. I haven't been to medical school or anything like that. So I was very aware of my own ignorance in that sense. But something which I found really useful going into that was developing my feminist curiosity. And like I mentioned before, that training with Gabriella Stringer was really useful to, not be afraid of the negative impact that would have, that maybe by not having prior assumed knowledge, some of those concepts which might be implied between parents and mothers, I would have to ask more about and make the implicit explicit.
Yes.
And that was really interesting as well. So that made me a bit more confident moving into that space and thinking, okay, well, I'll listen carefully, I'll dig deep, and I'll be ready to be surprised, which I think is also just a great ethos to have as a researcher. So I was very much still aware of the limitations, which were very real and very true between me and my participants, and I think there's so many ways that I'll know but also never know how that impacted the research. But it was interesting, particularly in the context of maternity, because I think in this day and age, so many mothers and so many pregnant individuals and women in general have this fear of like mum guilt and this fear of needing to perform in a certain way and be a certain way and be a type of mum. And that's very informed by culture and religion and general sort of norms in society. But there are these kind of heavy expectations placed on mums and mothers and pregnant people. And in a sense, not having my own experience of that was very helpful to developing that feminist curiosity. So I really noticed it when we were in interviews and people were talking about their specific experience or their specific perception of something, say like shielding or the mask restrictions. And mums seemed slightly somewhat hesitant in the beginning to kind of say what they'd really done. They were like, oh, well, the rules at the time were this, but I'm not sure if I should say this. I don't know if this is the right thing to say. And then I would kind of probe and say, oh, well, I've never had a kid, I'm not sure. Kind of reasserting them as the expert of their own experience. And then the dynamic would completely change. And then I would almost become the student in that situation. And it seemed to, it made them sort of lose the fear of judgment in a sense. It seemed like that mum guilt almost wasn't as heavy of a factor in the room anymore. And it just seemed, from my perspective, to set participants at ease and make them seem more relaxed about telling me their honest thoughts and beliefs in the way they were. So I thought that was just a really interesting kind of operationalization of that concept, but also kind of accepting that, sometimes I think ignorance can be used it can almost be beneficial to an extent. I think not always, and it's important to recognize the limitations of it, but it's sometimes handy to ask more questions because there's just not that prior assumed knowledge or that fear of kind of judgment, I guess.
Yes.
I hope that makes sense.
Absolutely. And I guess something that strikes me is it's the sort of bringing together of curiosity, which feels like it's at the heart of probably all good research, but particularly, I guess, noticeable in qualitative research where you're often coming with really open-ended questions rather than a particular hypothesis. You want to be surprised. You're coming with that curiosity, but I like the juxtaposition of that with feminism, with its, I guess there's a certain ethic that kind of comes with that means that when you are asking those questions to mothers in those interviews, I wonder if they can also detect something of that. Well, you mentioned about like the slowing down and the not being rushed, and there's something that there's curiosity, but it's curiosity that's alongside some other values there as well that sound important. Like, do you think there was any of that that also helped in your interviews?
Yeah, definitely. So I think this might be the wrong word for it, but I don't think of it as ignorance in a sense. But I guess like that. Maybe a lack of prior lived experience, and I think relationality is important, particularly in interviews between women, and that's also to say that not everyone who gives birth does identify as a woman, and that's, I'm using woman with the most inclusive term, that can be anyone who identifies as one. But I think there are certain things about the vulnerability of that situation and being a mother which is very, it's very easily scrutinized in society, and there's all these textbooks and books and self-help guides and resources to kind of dictate what a quote-unquote good and bad mother is.
Yes.
And there's so much sort of psychological and social weight that comes with that as well for mums. And I just think acknowledging that you don't have that lived experience and that you're open to whatever their definition is of it, and trying to come with that, I suppose maybe openness is a better word than ignorance. But I think that combined with a genuine curiosity and readiness to be surprised is just really useful for setting interview participants at ease, but also for just opening up all these areas of inquiry which might not have been, I guess, spoken about in such an explicit way before. Because, for example, because I haven't, I have a breastfed a baby or something, and they were saying about how hard it was, I could say, oh, and what was, what in particular was difficult? Do you mind expanding on that for me? And that wasn't a surprising question to ask because they knew that I'd never had that experience.
Yes.
Which, it was, more surprising than you'd expect, I think.
And I guess if you were someone who had that experience, then there's maybe the fear of being caught out, or you saying, oh, hang on, like, the fear of judgment, I guess, like that's there. Whereas I guess you're seen as someone who isn't so risky of judging in that situation.
Yeah, I hope so. I hope that's the the energy I gave off. But I think it's also important to recognise the limitations of that. So potentially probing into subjects which might be really difficult to talk about or might be extremely emotionally burdensome to discuss, and not knowing that because I don't have that emotional lived experience. So I tried very hard throughout the interview process to kind of gauge responses and gauge how much people wanted to talk about things. And also when people were, exhibiting signs of distress, if they started to look a bit tearful or to get a bit choked up, really taking the time to say, we don't need to talk about this, or we can come back at another time, and really try and let them to lead on that. Which was then also surprising because I think a lot of people wanted to talk about things and really insisted on speaking about difficult subjects because they wanted to, despite their emotional response. And it was almost an important part of the subject was that there was this heavy emotional weight to it. So it was a lot of different topics to explore in that, but a very interesting, I think, approach to relationality with participants and the value of it and the limitations of it.
Thank you. Is there anything else you want to say about this book before we move to your second idea?
No, I'm happy to move on,
So the second idea you bring today is a paper by Kimberle, Crenshaw, Mapping the Margins, Intersectionality, Identity Politics and Violence Against Women of Colour. So I guess just for those who aren't familiar with the term, would you mind saying a bit about what intersectionality is, and then to talk about what it has allowed you to see in your research?
Yeah, absolutely. So this piece in particular by Crenshaw looks specifically at intersectionality in relation to domestic violence and different experiences of domestic violence and such and that. And so she, I guess, a kind of clear definition in her own words at the start of the book is that she explains how intersectionality encapsulates that the experiences that Black women face are not subsumed with the traditional boundaries of race and gender discrimination as these boundaries are currently understood, and that the intersection of racism and sexism factors into Black women's lives in ways that cannot be captured wholly by looking at just race or gender dimensions. And I think that, says it perfectly, but I guess to put it in more less academic terms, the way that I kind of see it is that you can't use one lens to explore the multitude of experiences. So I guess in some ways that sometimes certain pieces aren't... What's that phrase of sometimes there's some...
Oh yeah, some of its parts.
Some of its parts doesn't equal the whole.
Yes.
And I really found that in my research as well, was that there was these very different experiences which demanded these different theoretical lenses in order to try and encapsulate the intersectional impact that was happening. So, for example, not shying away from the places where different forces of oppression were happening. So exploring the intersection of these impacts instead, and how certain experiences could be different and unequal, but for who and why were they different and what was contributing to these. And I think Crenshaw explores this brilliantly in her work, especially in relation to domestic violence. I think in the States, I believe it's in the States. And it's really nice to explore those kind of knots of where so many different things are happening, and it's making a very unique way of engaging with, so in Kimberle's case, in domestic violence, a very unique way of engaging with the authorities and the police. And I think it's also been used to explore how different people and individuals engage with health services. And it's a very useful lens to understand why people might do that, or why so many different things are going on to determine why one path to care or path to support isn't necessarily accessible to everyone. And I hope
that's great. And another way I've found it quite useful. Someone described to me intersectionality as a description of like why sometimes things aren't an additive logic. So it's not like being a woman and being black. You can just add the experience of what it is to be a woman and being black, but it's more of a multiplicative logic of something completely different happens as you said it, like it's not just the sum. Some sort of completely different experience comes out, and I'd be really interested to know, like, where did you see that play out in your research in experiences of mothers during COVID?
Yeah, so I think I'm very glad that you asked that question, because it's a really interesting part, and I found it interesting to explore. But someone who's written about this a lot before and who really informed my work about it was Claire Bamber and her colleagues exploring the collateral damage of COVID-19, I think was what their title of their work was. And it was exploring kind of the unequal impacts and the different ways that different people in society were affected by the lockdown restrictions, both in terms of like furlough and employment loss, but also in terms of who had to stay working, and who was differentially exposed to the virus and had the unequal consequences of exposure. So she kind of explores it more in relation to the virus as well, but also the policies. And I think it's also interesting to use intersectionality to consider the limitations of the policies themselves. So, the COVID-19 inquiry now has really pinpointed that the policies at the time had a very narrow definition of who was vulnerable. I think that's interesting to look at with this concept of intersectionality again, because we're looking at, if you look at the clinical definition of vulnerability, that would consider stuff like age and people with comorbidities and people who are pregnant, but without considering kind of different forces in society and different forces of oppression, it failed to consider people who might be living in overcrowded homes, people who might be living in violent homes or at risk of interpersonal violence, or the nature and exposure to the virus in their work. So I think Claire Bamber and her colleagues explored that really usefully prior to my research as well. But a place that this lens became really essential in my work was looking in particular at the experience of the restrictions of birth partners, and sort of the different consequences that these restrictions had on women in hospitals in particular. So, for example, in a lot of my work, a lot of my participants identified as Black or Black African or Black British. And I'm not sure if you're aware, but in the UK and in England, there are very unequal risks associated with ethnicity. So one of the very famous statistics is from the Embrace reports, which was that women who are of Black ethnicity are at, it was 5 times higher risk, I think it's now 4 times higher risk of dying in childbirth as opposed to white women. And South Asian women are also at higher risk. I can't remember quite how much at this moment. I think it was 2 times higher risk. But so very unequal impacts. And when that was explored a bit further in recent years, it was found out that could partially be due to discrimination in care settings. And in my interview participants' experiences, many of them described the important role that their birth partners played, not only in terms of helping to provide basic care after birth or in birth, but to act as advocates, to advocate for their rights and to ensure they were getting good care and to sort of fight on their behalf if they weren't receiving that good care and being discriminated against. So, and that was also something that was echoed in the birth rights reports and etc. But so when I was exploring the participant experiences, a lot of for example, participants who identified as white British, they very fairly discussed the partner restrictions as, difficult and unfair and very harmful in the sense that it exposed a lot of wider systemic issues with maternity care in general, that their, partners were relied on extremely to provide basic care and comfort and support for the mother during birth and after. But also that, partners then missed out and, lost that pivotal experience of their child's birth or the early days after birth. But for non-white participants, there was a different element of urgency to that. And one of my participants spoke about it at length in terms of this sort of hypervigilance that she had to have during her birth. So she mentioned not only was she already aware of the inequalities which Black women faced in maternity in the UK, but she had to arm herself with this hypervigilance of needing to appear as a calm and collected patient. And this was a phenomenon which was explored, like I said, by the Birth Rights Inquiry and different organisations, but it's this idea that non-white women have to present in a certain way for their concerns and their complaints to be taken seriously by medical practitioners in the way that many white women don't have to think about during labour and birth. So she described this as just extremely difficult and an extremely burdensome weight on her mind during giving birth and in a stressful labour, which was preterm as well, I might add. And on top of that, having to worry about her care not being addressed properly, but also how she was presenting as kind of, quote unquote, the ideal patient in a sense, and not to give practitioners further cause, quote unquote, to discriminate against her. So I think that then shows the role of that intersectional lens. And, Kimberle Crenshaw explores this relation in particular in terms of Black Americans and domestic violence in relation to the police and reporting stuff to the police as well. So this weight of the presentation of yourself in a society which very readily stereotypes you, and the role that that has on your well-being in these highly stressful and very painful, birth is very painful settings. So that just was a really important, I think, theoretical lens to explore that very complicated scenario.
Yes, and you can just immediately see there how, had your results been flattened to just women in general and their experiences, you would be able to say something that it was burdensome to everyone, but in a way that would miss something really quite different and quite the in terms of thinking about the repercussions of that as well, has very different repercussions in terms of the different harm that different women were exposed to and the action, I guess, that one might take. So no, it's a really good example of the value of intersectionality. Was there any other kind of intersectional, factors that you took into account as you looked at, as you listened to women and looked at their experiences, apart from race and ethnicity, in your research?
Yeah, definitely. I think, obviously socioeconomic status and income was a large one, but also just different cultural customs tied up with motherhood and expectations of motherhood on behalf of different families. And so there, the intersectional lens, which I applied and which was very useful in exploring that work, was, it could be a number of things, but what comes to mind is one of the previous concepts I think Ada Hassan explores in her version of this, her episode in this podcast, and she explores totality in this sense that, no experience, we can't view them under the same lens of totality, and like you mentioned, there's going to be so many different experiences. And there's not just a unified norm, so to speak. And I think that speaks so strongly to just motherhood in general. There's these really strong images of like motherhood and what a mother should be and how to succeed as one. And so many of those things just fell apart during COVID as people were isolated from family support, they were isolated from their own mothers. So another really important aspect of this was kind of exploring income differences, but I also mentioned kind of cross-cultural differences because so many people during and after birth, rely heavily on the support of family members, but they also want to ensure that their child gets to take part in all of these different cultural customs. So a lot of traditional customs might say that, grandparents are very involved in different ways, or in some cases the maternal mother, so the woman's mother, the grandmother, will live in, or they will live in with her after the birth to provide very specific types of support and care. And that just wasn't allowed anymore in lockdown, and that had a very unique impact. And I think by taking the intersectional lens, it was possible to kind of explore why that impact was heavier on some people than it was on others, and why some people wanted and needed that support more than others, but also the drawbacks of some people had moved in with family at the start of their pregnancy journey in anticipation of wanting that support, needing that support, and then lockdown happened. And suddenly people had lost jobs, people were on furlough, and they were living in these really overcrowded settings. And then I mentioned income differences again as well, because if you'd lost your employment and you were suddenly financially insecure, there wasn't the option to just up and move. So people again going through these motherhood experiences with younger children in these very crowded settings, and the unique and differential impact that had. So yeah, I guess that's another way to explore that intersectional lens. But once again, I think the great thing about intersectionality is it doesn't stop with you're a woman, you are this, like exploring each of the facets, adding up. It's exploring the kind of combined and intertwined effect of all of it together in different settings. So that was very useful in exploring this very complicated phenomenon.
Yes, yeah, and I guess it's another example of that feminist curiosity as well that you're showing there of so many of those things. Now you say them are like, they are intuitively true. You can, even without coming with prior knowledge about this, I think, wow, that must have been so difficult and so uniquely difficult in those different situations, but without that curiosity. And I guess curiosity and intersectionality feel like they're kind of partners here somehow. I don't know what you think about that. But
Absolutely. I think that was I'm sure someone else has said this before as well, but I guess at one point in my thesis I was really advocating for the use of an intersectional feminist curiosity or a critical intersectional feminist curiosity. So really considering, female and the gendered experiences of these, or women's experiences in a more inclusive sense, but then also all the intersections within that as well. So not seeing that experience as universal and understanding the different impacts of, for example, racism and colonialism and white supremacy within that, but also class and ableism, etc. But yeah, and I think something which was personal to me and inherent in that exploration was the use of mixed methods. So I mentioned before that my work was mixed methods. I have my background in social sciences, but also in quantitative and epidemiological research, and that I really enjoyed kind of playing with the tools that each discipline could provide to explore these complicated scenarios.
Yes.
And I'm working in a unit now which has it really uses big data in a very meaningful way to explore and describe these inequalities and unpack exactly who is at how much increased risk and where and potentially why. But I think it's still limited to describing the problem. And that was where I really enjoyed the qualitative element to understand, what was the experience of that? Why did people think it was happening? What was their unique lens of their lived experience that could maybe be that missing puzzle piece, or create a whole separate puzzle, which we couldn't explore through quantitative data, but opened up a lot of future avenues of analysis. And I think other mixed methods researchers, I can't remember their names exactly right now, but have described it as creating mosaics of data. And I think for something as complicated as lockdown, and to explore the unequal impact of lockdown, that was where mixed methods was just brilliant, to explore those different realities, I suppose.
That's brilliant. Thank you. Is there anything else you want to say about this book, this paper, or intersectionality before we move on?
I don't think so, other than just that I found intersectionality a really useful lens. Well, I suppose, I do. But I found intersectionality a really useful lens to explore the dynamics of power, specifically in maternity settings as well. So I think seeing the different experiences of different women in maternity settings was important, but it also highlighted the different power dynamics which were at play and how those affected different women differently, and the opportunities they had, or the tools they had available to them to sort of fight back against that power, and how that was very different depending on individuals' education or personal circumstances or social support, and that's explored a lot in relation to as Kimberle looks at it with domestic violence and authorities and stuff, but in obstetrics in particular, I found it really interesting because other researchers have looked at this issue of power dynamics in maternity settings and, the issues of racism, oppression and colonialism, and that enduring impact on medicine in that field on human experiences of birth has been explored in by Rachel Chadwick and colleagues in terms of obstetric violence, and a lot of work has looked at that in particular in Latin America. But more close to home, a researcher who resonated very closely with me was, her last name is Huschke. I think it's Suzanne Huschke. But she's done work in Ireland, and she's kind of explored the authoritative knowledge and technocratic hospital cultures and risk-based discourse around birth, and how that can disempower a lot of women in their own maternity experiences, and explores a lot in terms of like rights-based experiences and informed consent, and how that can get very messy, particularly in emergency delivery situations in obstetric settings. And that, again, in lockdown was such a massive part of my work, as people were in these settings where they had to prioritise protection from a virus, but then also women were undergoing these very isolated and traumatic birth experiences. And there was a lot of biopolitics at play, which I know is something Eska's talked about a lot as well, but that's another very interesting lens, which intersectionality opened up a lot, which I'll stop at that because that could go on for a while.
Yeah, that's brilliant. Thank you so much. And let's move on to your final idea you've brought today, which is an article provocatively called The Health Disparities Industrial Complex by J.M. Ezell, published in Social Science and Medicine. So can you tell us what is Ezell's kind of notion of the health disparities industrial complex, and what has it done in terms of how you think about what you do as a health inequities researcher?
Yeah, so this, I'll give everyone a little warning. If you work in health inequity, it might give you a bit of an existential crisis. But I think a very needed one. But so I guess I'm definitely not going to encapsulate this well enough, so have some grace with me. But I think Ezell basically posits that there are certain industries. So, for example, he cites Eisenhower's military-industrial complex in the United States and around the world, and Angela Davis's prison-industrial complex in the United States, and how there are certain industries and concentration of power where a certain number of people profit off an industry which might be harmful to society as a whole. So, for example, in terms of the military-industrial complex, Eisenhower explores this in the sense of the large scale, like the massive spending on military and the industry and the economics behind, I guess, what we now consider like the arms trade and all of that, but the massive economic side behind military, but how that's used often to, impact power and affect bad states, or essentially causes war, which is something that no one wants and is very bad for society in general. Sorry, it's a very simplified version.
No, it's
if
good.
Ezell ever listens to this, I'll be heartbroken. And then Angela Davis's example with the prison industrial complex explores, the linkages between systemic investment in construction and staffing and provisioning of prisons and jails in the US, but then also the different requirements of what it takes for someone to be imprisoned in a country. So specifically looking at Black and Latino and Indigenous drug-related crimes, and how a lot of people are massively incarcerated, but to what extent is that mass incarceration to support an economic industry of prisons, which again, prisons serve very little for social welfare and very ethically questionable. So with that understanding of like harmful industrial complexes, he applies that to health disparities research, and he kind of describes that health disparities researchers tend to over-investigate and over-explore certain research bubbles, and that there's a lot of power, but also a lot of funding, a lot of impact with journals, and there's a whole economic industry, so to speak, behind health disparities research, and that's, so in other words, research into health inequalities, we might call it in the UK. And that a lot of funders now prioritise research into health inequalities. But he basically describes that this is, it's descriptive, it's exploring a lot of issues in a sort of salami slicing sense, so people trying to find a certain niche so that they can get funding and explore an issue and be researchers and get published. But to what extent are we solving these issues? And so I came across this paper at the Society for Social Medicine and Population Health Conference in Glasgow this year, where I was very fortunate to hear Professor Ezell speak about his paper and the remastered version of this paper. And it just really echoed a lot of the other kind of key speakers' points across the whole conference. So another professor, Professor Inskip, Hazel Inskip from University of Southampton, had spoken a lot about health inequalities as well in the UK specifically. And one of her key points was sort of, are we fiddling while Rome burns? You know, what has research into health inequalities and public health achieved at actually reducing inequalities and improving health overall? You know, are we, I think she described it as, are we too busy tinkering around the edges while inequality in health gets worse, basically? And then another professor, Professor John Lynch from Australia, had spoken in his work about how, you know, again, we have so many RCTs, we have so many trials, but we have very little useful evidence to policymakers for big issues, for example, like child abuse and neglect. So there's a lot of work and investment going into things, but that work and investment isn't always useful to address these problems. And that, you know, we need to engage better with policymakers to ensure that that is useful in addressing questions which need answering. And so it's all this kind of existential issue, I guess you could say, about, you know, I think he has kind of three key mechanisms that the kind of constructions and behaviours and policies in healthcare create and sustain minority disadvantages in health. So, for example, the fact that a lot of these issues aren't exactly solving health inequalities, but there's a lot of research happening in it. And he also speaks to the inequalities within research institutions. So I think he speaks about, you know, universities more widely, and the fact that a lot of people at top positions in universities and researchers and PhD students are not from the minority populations which they're focused on, and might be to some extent quote unquote health research tourists. And, you know, do they have the same drive to solve these inequalities rather than just understand them? And then the third kind of key point is that, is this research capable of actually addressing these inequalities? You know, are we engaging with the right people at the right time to ensure it has an impact? Or is it just going to, you know, how they describe the valley of death, where research is made and it either gets published or it doesn't, but then it might sit in a journal forever, or it might not make it to a journal and never have an impact. So yeah, I hope that explained it.
Yeah, wow, this is really good. It's a really good challenge, and I don't know, there's different directions to go in, but I guess one of the things that it resonates with me is this, the question of, I think that second question of, how committed are you to really trying to change this thing? Like, do you feel it in your bones of like, I actually want this to end and I'm willing to fight for it? Or is it kind of just still at that level of like, oh, here's an interesting question that might kind of get my career a few steps further? And I don't know, I guess one of the questions, I'd be really interested to know like what you've done with the challenge that this has kind of brought up for you, but maybe one of the questions that I'd like to hear you speak on in response to that is like, as you look to like what you do next, and I'm assuming you're interested in continuing work along health inequalities, that may be a wrong assumption, but what practices do you think could allow one to maintain or to gain that moral clarity and that the sort of fire in the bones? It's like, I am going to do what it takes to give it my best shot to actually change this thing, rather than to simply feed this machine that is the another industrial complex.
Yeah, I think, nicely in the paper he does offer some solutions, which is hopeful. And I think it's really informed the way that I want to be as a researcher and the way that I want to work in research going forward. And also kind of, you know, post-submission, not kind of leaving my research as it is, but really driving it forward still. And I think that's, you know, I'll get onto that later, but the real challenges that come with that as an early career researcher as well. But so in his paper, he posits that, you know, some ways that we can overcome this. A key way is, I think they call it in the States, participatory action research, PAR, which in the UK we would understand as PPI, so public patient engagement or involvement. And I think that's something I've also seen the value of in my own work. So to make sure that you have work which is really addressing patients' needs, you have to engage with those patients. And to some extent, not just engage, but co-produce research and involve them at every step of the decision-making. And I think in his paper, but also in my research experience, I've really witnessed, what they call tick box PPI and tick box participation, where people have an idea, they've gotten the funding for it, and they've basically already decided what they want to do. But now, because of ethical procedures or, publication requirements, whatever, they feel the need to engage. But it's just a bit too late.
Yeah.
And it means that engagement isn't meaningful and it doesn't really have an impact where it should. So I think it's, again, that message of engaging with people who you'd like to affect change for as early as possible and involving them as much as possible. And there are really big challenges with that. It's very time consuming, it's very costly. And I think if we're going to do that, funders and institutions really need to consider, giving people the meaningful time and resources to enact meaningful PPI so that we can be sure that our research is actually going to have an impact. And that's considering stuff like direct payments as opposed to vouchers to really compensate people for their time and incentivize them to take part. But also, for example, the specific needs of certain populations. So for women, supporting childcare, supporting transportation costs, not just for herself, but maybe for her infant as well, or her children if they're not in school at that time. So, really thinking through good PPI, I think, is a way that we need to make research better to address these inequalities, but also a way that it's informed my personal research journey going forwards, not just following my research interests or where my curiosity leads me, but really seeing what's meaningful to patients as well and to the public and having them notice the things that I might have missed. And it just makes research better on the whole. It makes you think about things differently and consider things that you wouldn't have been able to beforehand. And I think, again, like feminist intersectional curiosity can all lead into that too.
Can I ask you just on that one of... have you, because I love that idea of rather than just following up what your next interest would be, to actually engage with the sort of almost like review or whatever engagement you've got from people outside of the academy with your work, has that happened yet? Have you got something where someone said something, it might just be a throwaway comment, but where you thought, okay, that's important for me I've got to do something that speaks to that with whatever I do next? Or is it more like that's what you hope is going to happen going forward?
Well, I guess it's a bit of both, because part of it is I hope what'll happen, but also what I'm sort of planning to make happen. But again, that all comes down to resources and, for PhD students, we have a certain amount of time to do work and a certain amount of time of that is paid. Sadly, I'm past that point now, so whatever I do is going to have to be unpaid or just somehow push it through with the support of collaborations. But I think there are certain organisations which have been pivotal in that. So there's a brilliant PPI organisation called the Motherhood Group. They do fantastic work in the UK and in London specifically, focusing on Black maternal experiences. And they've been brilliant to engage with in terms of even attending their conferences and their workshops. They do so much to make sure that patient and public voices and priorities are brought to the fore. And I think you don't even need to come with something pre-prepared, but just going and sitting in those spaces and listening and being curious. It's amazing what you'll come out with, because there are so many things which I was not sure how to approach in my research. I'm not sure if you could approach it as research, which then engaging in these spaces and engaging with our PPI team here at Queen Mary, Katie's team, who are brilliant, they kind of open up all of these different avenues of investigation, which you would have thought previously were too minute or not big enough to worry about. And really just expand them as topics which you're like, no, this needs to be a focus. And it's being focused on by patients and by the public, but it's just not being considered a priority by funders yet. But it could be the missing puzzle piece. So I think it's, not always being driven by where the highest funding is, and also having belief in ideas and with public ideas and driving stuff forward, even though it might not be the flashiest project, so to speak.
That's great. And I really like that. point of just sitting in a space where people are discussing what matters to them, even if it, I guess, doesn't count as like a formal, like basically decentering yourself as the researcher and your ideas. Because I guess a lot of the time people are picturing, you know, I go along and I get feedback on my idea, but actually to just be like, well, what's actually just in the water here? Like what's in the air?
Exactly.
And that takes a different way of being, I think, that feels like it might be a intersectional feminist curious approach, if I can use your term.
No, absolutely. Yeah, you're drawing linkages here, which I didn't even see. But yeah, definitely. And I think this idea that you need to, like, there seems to be sometimes this very, like, almost prescriptive way of doing PPI where you present and then you get feedback and that will make it useful. But in my experience, that's never really been the case. I've found it most useful when I actually haven't presented at all. And so, for example, I think you can support these organisations by, you know, attending their events. And, you know, for example, the Motherhood Group does a brilliant conference every year called the Black Maternal Health Conference, I think. But yeah, and you can pay to attend that. It's not expensive, but it goes towards supporting them, and it goes towards supporting having a safe space for women to talk about their issues and their concerns, and just having some solidarity, I suppose, as well. But so I've never presented at that conference. I've never asked to present, partially because I thought it wasn't the space for me either to dominate. And I've learned so much more that way, in a sense, by going, you know, almost as Cynthia would say, with kind of no expectations and just sitting there and absorbing. And it's really surprising how quickly you just find connections and find things that relate and inspiration, I guess, so to speak. So I think thinking of research and thinking of the almost who, how and why it's coming about. So, you know, who's doing this research? Are they part of these groups? Are they part of these minoritized groups? Are they engaging with them? How are they engaging with them? And then why is the research being done? Is it being used to describe or understand or intervene? And then how is this research capable of affecting inequalities and reducing them? And I think for me personally, to get back to your original question of what now, past PhD, I think I'd really love to move into that space of translational and applied research, because I think so much is focused on describing. And, you know, this is again something that the NIHR has spoken about wanting to move away from, is descriptive research, because we know the problem, we generally know the scale of it, and we generally know who's vulnerable, and very important research has gone into informing that, and that does need to continue, but there needs to be a bigger push and a bigger drive for the how do we solve it research and the implantational and the interventional research. And I think that's what Ezell calls for, and I'm hopefully happy to follow that call. I don't know if I'll be able to, but...
Thank you so much. Well, I really appreciate you speaking for the podcast today, Iona. Thank you so much for coming.
No worries, thank you so much.
And thank you everybody for listening to this episode. We will be back with another episode soon.